Nowadays, people know about diseases like asthma, emphysema, COPD, and acute chronic bronchitis very well. Pulmonary inhalation treatment becomes the preferred choice for curing above diseases. Using proper inhalation appliance according to age period will achieve a better effect of treatment. In Europe, aerosol plays a dominated role in inhalation preparation, outclassing dry powder inhalation and nebulizing inhalation. Here are some advantages of applying aerosol for curing asthma. 1. Medicine can be directly inhaled into the lung without going through gastrointestinal system. This brings irreplaceable advantages, such as avoid liver in the first pass effect, sight side effect, and fast onset compared with other dosage form on curing respiratory system disease. 2. Medicine is stored in closed container so that the medicine is not easily polluted, not contacted with oxygen and moisture in the air, and this increases the stability of the medicine. 3. Easy to use. Press and inhale, suitable for peoples of all ages, and help increase patients' drug therapy compliance. 4. Metered dosage valve control, accurate dose, single or multiple dose administration. It is easy to use aerosol for treatment, but not easy to use in a correct way. Low rate of deposition in the lung, due to high rate of deposition in oral cavity. Even taking correct skills, only 20% amount of the dose of aerosol can reach to the lung. GINA, Global Asthma Alliance, points out, using MID together with spacer can improve efficiency of medicine transferring. Using MID together with spacer can improve efficiency of medicine transferring, increase medicine deposition, and reduce local and systemic untoward effect. Properly using pharmaceutical aerosol can well inhale active pharmaceutical ingredient into the lung in order to maximize effectiveness. Grasp the rhythm of inhaling and exhaling before using. Now, let me show you how to inhale and exhale slowly. Little kids, shall we practice inhale and exhale? Good job! Great! Take prescribed medication. Sufficiently shake the MDI 5 to 6 times to mix the medicine well. Remove cap and connect with spacer adapter. Kindly remind, do not use oily cream before using spacer, and do not use it 2 hours before meal or 2 hours after meal. Place the mask over the kid's mouth and nose securely before inhaling. Hardly press MDI 1 time and ask the kid immediately, inhale slowly. After the kid breathes slowly, 8 to 10 times, around 20 seconds, take off the mask. If need 1 more time MDI, you should slightly move away the mask and let the kid naturally breathe twice, then repeat above steps. During the process of inhaling, patient must keep the flow signal whistle quiet. Keep peacefully inhaling so as to maximize the effectiveness. After finishing inhaling, take off the spacer, put on the sealed cap, and put it under shading and dry place, avoiding to contact open fire or exposure in the sun. Then help the kid wash face and mouth in order to clean the leftover medicine in mouth and on face. Clean spacer once a week. Disassemble all the components and soak in lukewarm water with liquid detergent for 15 minutes. Then wash the dishwashing liquid with running water. Dry the spacer in a clean place. Never scrub the inner wall of the spacer so as to avoid static electricity affecting the effectiveness. Finally, put spacer into specific container. Parents should bring spacer for the kids when going out. This is the complete process of the using and cleaning of spacer. Using a spacer while taking MDI medication could easily transfer MDI active pharmaceutical ingredient and safely and effectively reach the therapeutic aim.